I fully expected to rant about this yesterday. It was just a busy day. It was a lot going on, which I'll give you updates about that too. But this is going to be today's post-Wednesday rant. The thing about irregular cycles is, and this is with or without the actual diagnosis of polycystic ovarian syndrome, because PCOS is a reason why some people will have irregular cycles. But even apart from that, full diagnosis, a person does, if they're not on hormonal birth control, need to have a shed, a period, a uterine lining turnover at least every 2 months, right? And the reason for that is because if not, the uterine lining can actually build up and become abnormal. I really want to get more into this subject, but let me start a new video for that. And so think about the uterus like a hotel room, okay? Okay, think about the uterus like it's somebody grandma's house who is a hoarder, okay? And that's a uterus that's not turning over every month. It's not having a cycle every 1 to 2 months. This person is bringing in things, and never bringing anything out of the house. And therein lies the problem, because that can become abnormal, right? In the house, you start getting crusties, you start getting bugs. If it's cats up in there, it's cat poop everywhere. Like, you need to shed that uterine lining every couple of months, just like that person needs to come. Somebody needs to come clean their house out periodically, right? And so that is why a person needs to have a uterine lining shed, even when they're not on hormonal birth control, specifically when they're not on hormonal birth control. If you're on hormonal birth control, that is where my analogy of the hotel room comes in. Imagine you have a vacant hotel room. Nobody's up in that joint. Ain't no sheets on the bed. Ain't no, towels in the bathroom. That room can stay empty for as long as it needs to stay empty. It doesn't need to have a full clean, because there's nobody going in and out of it. Nothing is coming in and out of it. And that's the state of the union when a person is on hormonal birth control and say they don't have a period. Like me, I haven't had a period for a long time, but that's because my uterus is empty. Doesn't need to shed. That's a different pathophysiology than somebody who doesn't have a period when they are cycling every month, because the whole physiology of a cycle is that you're building uterine lining, and if it doesn't come out, then the next month you're building more. And if it doesn't come out, the next month you're building more. Like, that's where you can actually run into problems. But again, I'm not cycling, like I'm not building, so there's nothing that needs to come out. Now, why is that relevant to this question? It's relevant to this question because it is important to cycle and specifically ovulate when you're trying to conceive, the TTC, trying to conceive, right? You need to ovulate in order to do that. But it's still important to have some semblance of cycle turnover, of uterine lining turnover, if you're not on hormonal birth control, even when you're not trying to conceive. So like the theory of not needing to have any kind of attention to super irregular cycles unless you're trying to conceive is unfortunately not complete. Yes, a person doesn't have to have a period every month. It could be somewhat irregular, but you need to have some sort of turnover periodically. Otherwise, you're setting yourself up, or you're not setting yourself up intentionally, but you're setting yourself up for problems with that uterine lining. But if you're cycling irregularly, but it is every couple months, then you should be shedding that lining enough to keep yourself safe, which is the goal, right? So it just comes down to how often you're actually cycling. Like, I don't want this person, whoever asked this question, or anybody out there, to say, well, I don't have a period, I have a period once a year, but I'm not trying to conceive, so it's okay. That's not okay. That's a uterine lining potential issue, and it actually can put you at risk for uterine cancer. But if you're somebody who, it's just kind of unpredictable, but it does happen at least every couple of months, then you should be okay. And then again, once it's time to conceive, now we have to figure out and intentionally coordinate the ovulation shed cycle so that we can catch an egg and try to actually impregnate. You know what I mean? So it becomes, we have to be a little bit more targeted when you're trying to conceive and make sure that we're supporting that ovulation in a timely way that we can actually catch it. But it's not the same as, if you're not trying to conceive. It's not as important typically to time the cycles. Now, if you want to time your cycles just because you feel like, you want some predictability and you don't want to be surprised, then, hormonal birth control can help with that. It can help with just the predictability, the not random bleeding, or even some people who have irregular cycles and have that cell turnover unpredictably, they may bleed for 2 weeks. That sucks. So you may not want to do that, but if you bleed for only like 4 or 5 days, but it happens every couple of months, like, that's okay. So I hope that shed some light. I hope that lended some understanding. Yeah, it's early. Y'all have a good day. Subscribe, don't forget.